I really hope y'all can see my screen. So the first resource is Parastats by Marchadimes. Marchadimes, as you guys know, is generally focused on babies, but they have been doing a lot more getting data for moms as well, so maternal and infant data. As you can see, when you come to their website, they just have some things scrolling across the screen. But if you want to really specify your community, like let's say if you're in, I'll just do Georgia, and you specifically want to get information for your state or even your city, this will show you a county map of Georgia, right? Preterm birth. But if you want to even go even further down, actually, that's not. If you want to get a different topic, then you can go here and look at a variety of different topics, including information about maternal health and not just infant health. And something that I like, let me see if I can get the data from Georgia. I do this a lot with the state of Maryland, but sometimes you can click something and it's not information that can be put on a map, but it's just like a list of statistics. And so I find that to be particularly helpful. I would encourage you, if you're okay, it's not gonna work, that's fine. There may be information like this where there's statistics. In 2009, this number of women in Georgia had WIC or something like that. So you're gonna not only get images and maps and things like that, but you're also gonna have the option to have some narrative. But make sure that when you're getting this information that you either save the link or something, or get the source at the bottom of the page, because even if you're screenshotting a map or something like that you want to use in slides or provide to a family or provide for something, you want to make sure you always have the source. So Parastats is great. In the doula world, there's a lot of work that we do that people consider quote unquote alternative, or they consider it to be something that they think is all new and different, but it's something we've been doing for hundreds of years, or that they're doing in other countries every day. And here, just because someone is not making money off of it, or a corporation has not found a way to put a price tag on it, somehow it's alternative. I have found a fantastic website, and I love the folks over at Evidence-Based Birth, and they have a variety of different topics that they put on here. I always am sharing the placenta encapsulation page, because I don't know how many times a week the conversation about placenta encapsulation comes up. They have videos, they have, you see where it says links and resources, they have evidence-based research from a variety of different universities, institutions, both domestic and international. But I really love this website because it's very inclusive of topics that aren't just centered around clinical medicine and just centered around what they would consider like Western medicine. I remember not so long ago, someone asked me a question about evening primrose and about natural ways to induce or things like that. And I was able to find it here. Evidence-Based Birth gets like 1 million hits a month. I'm not, their what you call a brand ambassador or anything, but I love this page, and I also encourage it not only for doulas and birth workers and advocates, but for researchers and for students, especially if you're someone like me who kind of straddles that line between being both a birth worker and a scientist. And sometimes the questions are pulled in both sides, but this website does a really great job of bringing those two things together. So obviously in the United States, the CDC, getting CDC data is like, that's our standard, right? So every week, the Morbidity and Mortality Weekly Report, or the MMWR, comes out. And there's a variety of information about there, not just about moms and babies. I just pulled up this example because medical or recreational marijuana is legal in a lot more places now. And so I just wanted to use this as an example of a way to find data on something that also is emerging, but there is research on it. So if you go on here and you click in the search box and you type in whatever it is, let's say you typed in marijuana use during pregnancy and you came up with this paper, and you're like, I'm not trying to read all that, Vanessa. Why are you telling me? Look at all them words on that page. That's doing way too much. This is very academic. Or I got something in 15 minutes. Like, I just want to tell somebody something because I'm trying to get this grant. Something that I like about MMWR is when you look at it on the PDF version, or if you look at it on print, there is a blue box, the blue box, just like macaroni and cheese. And the blue box shows you the quick and clean, the quick and clean, what do we already know, what's new, and what does this mean? So I like, if there's a topic and it's, you know, in this case, 6 pages, or maybe it's 38 pages, and I'm like, okay, what do we already know about marijuana? What do we know that's new now about marijuana and pregnancy? And what are the implications in public health or maybe in your work? And once again, I'll say the same thing I said before. If you screenshot, you know, or clip graphs, just make sure you get the citations that go with it as well. So MMWR is always dope. And this was the paper I just showed. Another option is PRAMS. It's also by the CDC, but it's the Pregnancy Risk and the Pregnancy Risk Assessment Monitoring System. The thing about PRAMS is, one, not every state participates in it, but I basically call it like the pregnancy census. So they get information from pregnant moms. But like I said, because not every state participates in it, you may not have it for your state. In particular, if you're in a Southeastern state, you either may not have it, or you may not have the data that is, you may have data asking them questions, or they're not filling it out, or they're not filling it out with care, right? They're just throwing it together, and then the analysts at the CDC are like, well, what are all these gaps? Just like that Georgia map I showed you a couple moments ago, where at the bottom it said some of the information was suppressed or incomplete. But what's great about PRAMS is that they already have a bunch of reports that you can just find and pull things from. I don't think I have it on the screen, but so that you don't have to like get raw data and like analyze it yourself. You can just find reports that are already made and find your state. And if you're on a computer or a digital device, you can just Control F, find your state, find your community, and get that information. And a lot of it, because it's about risk assessment, it's about the experience of the mom, what was happening during her pregnancy, not her clinical outcomes. And so when you think of doulas and birth workers, scope of work really focusing on physical and emotional support, finding out more about the experience of a mom during her pregnancy could be helpful. Once again, none of these are perfect tools, but they are what we have. Another thing that's imperfect about PRAMS, like anything else national, is the data comes out slowly. I think we just got 2018 data available, maybe 2019, but I remember a few years ago when we were like, when is the data coming? All that was available was I think during the last presidency, 2016 data was the only thing available the whole time. Like for the past 4 years, I don't think we had any new data. And then 2018 or 2019 just came out recently. So shout out to the folks at CDC for doing their thing. Something that was mentioned that Jessica said, and I guess Chanel also alluded to it in our conversation, was about, Chanel said it for sure, is this idea of like scaring people. When we talk about Black maternal death, and we talk about Black infant death, and we talk about the experience of undocumented people, and we talk about kids in cages, and we talk about the fact that Breonna Taylor wanted to be a mother, and we talk about Serena Williams. These are very traumatizing and re-triggering and very uncomfortable topics. It is not fun to talk about these things and re-experiencing them all the time. I tell people, when in my dissertation like experience, I wake up every morning and go to bed every day reading about dead moms. That's not fun, right? Like it's not. And so one tool that I find very awesome is this idea of asset framing. And it's the idea that when you're talking about your experience, or you're talking about someone else's experience, this is particularly important for white folks, is when you're talking about somebody else's experience that is not yours, why are we always talking about the grim and the doom and the negative up front? We love to do that when we're talking about Black people. We talk about what she did wrong, what's wrong about her, what's wrong about her baby. No, there's something called asset framing. And I'm not gonna go too much into this because I know I wanna wrap up on time, but if you look up these links on YouTube or online, there is a fantastic gentleman who has a couple videos where he talks about what does it mean to reframe the conversation about something that is negative and turning it into something hopeful, just like Chanel and Jessica talked about earlier. We may not be able to solve white supremacy and racism in our lifetime, but we can probably talk about solutions and approaches in a hopeful manner that is both insightful and eye-opening for white folks and not spiritually exhausting for people of color that are working in that space. And so it's super important. Since I only have about 5 more minutes, I'm trying to determine whether or not I want to show you this last. So I'll just show it to you for awareness. I'm not going to workshop through it, but what I'll probably do is maybe make a video and then post it and you guys can see. CDC Wonder, as a data nerd, as an epidulalologist, as I call myself, and yes, I am epidulalologist.com. My CDC Wonder is so much fun. It's not complete, it's not everything, but it is a great tool. In CDC Wonder, you're able to see data that the federal government has collected one way or another, but you can see it all in one place. And so, for instance, if you do research around what's going on at the US-Mexico border and trying to advocate for families, if you are researching the past 7 years that Flint has not had clean water and the exponential increase in miscarriages and fetal deaths in the women there, you can click the fetal deaths page. I'm going to show you a couple of pages that might be of use and then go from there. Something that I find particularly useful is the infant deaths page. So this is for those of you who need to collect data about infant mortality that's not found somewhere else, or that you want to narrow it down to your community. The records link the baby's birth certificate and death certificate in the same page. So you're able to get information about the association between those two things, which I find particularly helpful. And what a birth certificate looks like if you're looking at birth data, which is always fun to look at, is I'm going to show you where it says expanded. Now, just only in 2016 were some upgrades made to the system. As you can tell, this page looks like it's fresh out of 1997. I really wish that they would make it a little bit more user-friendly. I understand that taxpayers' dollars need to go elsewhere, but I would really like this to be a lot more user-friendly. But let me show you something really cool that you can find on here. Birth certificates look different in every state, but some states collect a lot more information than others. And for the things that they all have in common, they're actually able to put here. For instance, obviously you can find your database on your state, or if you want to be more specific, you can open up where it says open, you can open up and find your county. If you want to compare Baltimore County to Montgomery County or something like that, or the different parishes in Louisiana. Unfortunately for DC, you cannot compare the different wards. I really wish you could for obvious reasons. It gives you the ability to filter by urbanization. So maybe you're doing like upstate New York versus the 5 boroughs. It's going to be very different information. But this is where I get excited, y'all. It extracts all kinds of demographic information from every time a baby is born and shows you the what do you call it? The anonymized results. You can find out a mother's, where she was originally born, her education level, her, obviously things like age. But then they also, in 2006, started putting information about the dad. And for me, that's particularly exciting because when you think about race and ethnicity, which, of course, are these man-made structures, but, a lot of times we kind of talk about white versus Black, but are we talking about a very specific experience of Black folks from the islands or Black folks from another place, or those that are Latinx or Hispanic but if they check a box, it's white, what does that mean when it comes to where the data is going, right? And so I just always find these things really, really interesting. And also, Black folks, we say, it don't matter if one of the parents is Black, the baby is Black. Well, if it's a white mom and a Black dad, or a Black mom and a white dad, how does that change the outcome from a baby? Y'all know I'd be asking these questions in my sleep. There's information here about whether or not the mom already has other children or already had previous, what do you call it? The death of a previous child. That's really, sometimes it is really important as a risk factor to find out if the mom has had other children. This is characteristics of the mom when it comes to, how much weight she's gained, or if she smoked during her pregnancy, and if she had other pregnancy risk factors that may have, and once again, this is on the baby's record. This is the baby's birth certificate record. For me, Section 7 is important because a lot of you all know I do a lot of work around hypertension. And since 4 out of the 5 leading causes of clinical leading causes of maternal death are associated with hypertension, I like to look at what's going on with moms in certain places when it comes to hypertension. This is interesting, but just so that you guys know, if you ever plan on playing with this, you can't do 2 categories at the same time. You can't do more than one variable at the same time. You have to do one and then go back, and one and then go back. So whatever. But I'm gonna workshop this for you guys in a different video. Here, whether or not the the mom had a past experience with sexually transmitted diseases. What happened during labor? As doulas and birth workers, we're always interested in like induction practices. This is, by the way, this always, number 10 always defaults to the most recent year. I like to click all years. Whether or not there is some different happening at different times of the day or different months out of the year. There's some research coming out about, what happens if a mom goes to an emergency room on the weekend versus during the week. And this whole idea of, well, who's on call during the weekend? Is it a whole bunch of students? No shade to the students. Or is there actually somebody, that has more experience present on a Saturday at 2 a.m., or whatever. So this is really interesting. And then of course, you may be wanting to collect data regarding if it's a C-section or not, if it's a VBAC or not. And then I love this medical attendant category, which I'm hoping will be expanded because it's not well defined. But we are seeing, we can use this section to extract data about the increase of this other, who is other, right? Who are other birthing attendants? We do know that the data shows us that there's an increase of other, but who is that? It's not doulas per se, because it says the word medical, but how is the data being collected? Are they talking about us? Like, we don't know. So anyway, I'm not going to go through this ad nauseum, but that you can get information about if a baby came early or came small, APGAR scores. Shout out to one of our white foremothers, Miss Apgar, Nurse Apgar. There's information about gestational age based on both clinical measures and last menstrual period. So depending on if you do the clinical measurement or the more holistic measurement. Literally, you guys, like, this is all information that is available to the public for free. I didn't have to pay to log into this. I just went on here. The issue is it's hard to use. And so that's why, like I said, I do want to take time to like workshop through it, but I do want you guys to know that it's available. If you do research on Down syndrome, boom, you can get all the information that you need on CDC Wonder if you're trying to find it for your state or find it, for your community. And the how, like I said, I'll show you later. Let me do one more thing and then we're gonna close up for the day. A lot of times, okay, y'all, if any of you guys have had a conversation with me, you know that I'm very critical of this situation with the like kind of insurance companies kind of directing physicians and telling doctors what they can and can't do based on whether or not they can or can't pay them. There's something I want to bring that into the conversation real quick. So the page that I use on a regular basis is the underlying cause of death page, because that's going to have all your codes when it comes to maternal death. I'm gonna actually I think I'm gonna do the middle one, 2019, I'm gonna do 1999 and forward. And by the way, this page that I'm clicking, I agree, is agreeing that I'm going to be ethical in my use of this data. I'm not going to show this to you today, and I kind of already talked about it when I talked about the baby's record. But I want to scroll down to something that you may be interested in playing with, and then you might have questions about, and that's disease codes. So ICD-10 is the International Classification of Disease, which is something created by the World Health Organization. And there's actually 11. ICD-11 is getting itself together. They're developing it, and I'm glad that they're developing it because they're adding social determinants of health in there in what they're called Z codes, Z as in zebra, Z as in zebra. And so they are adding a characteristics of a person, whether they experience homelessness, whether they experience racism, whether they have a variety of different things about their social determinants that might have an association with their health outcomes, so that people aren't just like, oh, well, this is a clinical, this was a clinical thing. No, this might have been something else that systems and programs and structures and the government and partnerships and anti-racist efforts could actually address. So I'm excited when those Z codes are expanded in ICD-11, but I don't think we're going to see that for a while, y'all. So in ICD-10, we have all the different causes of the disease, which of course you can Google, and you can Google how they align with billable medical codes, because that's actually very important to take into account. I'm not going to go into depth, but I will tell you something. It's really interesting when you find out how people, how different doctors' offices decide to put some information on your bill and other information on your death certificate, but that's another conversation. So when you're looking at, as the last thing I say, and then we'll go, when you're looking at the ICD-10 codes for maternal death and infant death, there's a distinction that I want to make. And that's here. So it's P codes and O codes. So you see how O says pregnancy and childbirth, P says in your mind, you might intuitively be like, oh, okay, yeah, I'm gonna select both of those. Cool. Let me control, let me command, shift, and connect both of those. No, they're not the same. O is for the mom, P is for the baby. So O, there's an O in mom, or O, the shape of her belly. That's how I remember. O00 or O99 is specifically characteristics of the mom that are associated with her death record. And when you open it, in case you forgot me saying this, or you cannot find this video on YouTube, it'll be clear because you'll see the word maternal, and you'll see things about delivery on that code. P code is about the PED. It's about the baby. That's how I remember the P is PED. So, and you'll see that because it'll say newborn this and newborn that. And if you're trying to find out if in your community there is some increased rate of something happening, birth trauma is very interesting to look into. Obstetric violence against the mom, which is in the O95 and O99 sub chapter. It's really interesting to see that they actually write that down, that they're starting to do that. But I just really wanted to show you guys this tool because if ever you feel like there's no data for something, the answer is it's available, just is it accessible? It's on this website, but how do I use it? So I'll do a how do I use it later. Okay, I'm gonna stop my share because I know I'm a little bit over time. I really pray and hope that y'all can see my screen. Let me see in the chat if y'all, I often wonder about data and how much is real, especially when we talk about, yes, when we talk about Black and Indigenous people of color who have had reasons to not answer truthfully when folks are collecting data. That is something that we call in public health social acceptability bias. If you have a survey, if you have an interview, or if you have something where you're gonna ask them, they're going to answer you something that's socially acceptable, especially based on the conversation we had. If we're talking about mothers who have formerly been incarcerated, or they don't want to get their kids taken away or something like that. Yeah, you're going to say one thing, but then it's like, okay, how accurate or how true it is. It's her truth. Her whole experience is her truth. But that goes back to what Jessica and Chanel were saying. It's not our responsibility to give you the truth if you're not trustworthy. It's their responsibility to be a little bit more trustworthy, right? One thing at a time, but you know what I'm saying. I just want to thank you all for, yes, girl, girl or guy. I'm sorry, y'all. I'm working on my gender pronouns. So please give me some grace. But I do want to thank everybody for tuning in. Like I said, I'll do subsequent videos where I can actually walk through, because I do want to show you all how it can make charts and it can make graphs, and it can really make some things that are tailored to the work that you do. And other websites, there's other websites that are free, but it's so easy to just tell people, oh, go find this online. It's another thing to like take the time and walk you through how to find meaningful, impactful data and information, especially if we expect our partners to do that. It would be good if maybe we knew how to do that, and then we could kind of lead them in that direction, kind of like I'm doing with you all today. Oh, thank you for the grace and thank you for the love. I want to thank you all so much for tuning in today.